Hello. Hi, good evening, everyone. Good evening. How's everyone doing today? Well, today is day 3, and I hope that you are preparing for winning proposals. Today, we're going to go straight into pricing strategies and negotiation tactics. At the end, as well, we will be looking at some contract tenders that you can, some portals that you can go onto to look for particular contracts for your organization. So, hope everyone's doing well. So, did you know that 70 excuse me, 70% of businesses are producing ineffective proposals, pricing, and their negotiation. And this is the primary reason for them losing a lucrative contract opportunity. So if my team can just let me know that you can hear me and that I'm loud and clear so that I know that we are live. It says that we're live, so I'm going to continue. So do you know, like I said, did you know that 70%? So let's get into some strategies for success for you for winning your proposals and pricing strategies and negotiation tactics. So when you're looking to prepare to win a proposal, so you're preparing your proposal, for example, you need to understand the importance of research, thorough research in crafting a successful proposal. Now, remember that I said to you that it's important that you speak with your community because your community will tell you what they need. Yes, of course, you speak with the government organizations, but the organization still has to get the information from those that need the service. So speak to your community because they will then be able to really give you some really good insights as to what you need to provide them with. So thorough research is one of them. So when it comes to contracts, healthcare contracts, whether it is between the providers, for example, and insurance companies, who it is that you want to work with, healthcare facilities, suppliers, etc., you as the organization want to ensure that you're able to meet the government agencies. So careful research is paramount to you to really know the specifics of why this research is crucial. Why do they need to use your services? And I'm going to go into this and I'm going to break it up step by step. So first thing, you have to understand what the client needs are. So there's research allows you, the care provider, to understand the specific needs that the buyer is wanting from you. So this is to do with preferences of clients, for example. So when you're a healthcare facility and is seeking a contract with a company like the buyer, for example, it could be a government organization, it could be a care home, for example, private hospital. You want to do the research of the demographics in that location because you want to know what the population is so that you're able to discuss this in your contract. You want to know what the health issues are and the coverage preferences. This can also inform the proposal content and structure. So sometimes when you're working with insurance companies, for example, then they will tell you what the cost that they're allowed to go up to and what they will cover. And it's the same when you're working with government organizations as well. So bear that in mind. So who is it that you're looking to contract with? Is it a government organization? Is it a care home, for example, or is it a insurance company? So you want to do a complete market analysis and research the competitive market trends. It's so essential for you as the healthcare organization that's seeking the contract. You want to understand what the offerings are. Look at what the competitors are doing. What are their pricing strategies? Pop in and go and see them in their offices, for example, or give them a call and see what they are pricing, what they're charging, for example. What new trends are coming up? Is there, because it all depends on the location of where you are as well, because sometimes it can be to do with the environmental, that there seems to be more of a need of a particular type of service due to the environmental and the location, for example. So this will enable you as the organization to position yourself effectively and to tailor your proposal to stand out in the market. You must ensure that you are meeting compliance and regulations. What are those requirements? What is it that they requiring from you? Do you need to be registered with a licensed body, or do you need to just have the relevant insurance and staff members are compliant and up to date and DBS, etc.? So find out whether there's any compliance and what the regulatory requirements are, because if you're not registered with the Care Quality Commission, for example, or the government that you want a license with, then, and part of that contract is that you're licensed, then there's no point in you going any further, because it will just, they would just close you down, for example. They won't use you. So you want to do thorough research. Why? Because it ensures that your proposal is aligned with the relevant laws, regulations, and the industry standards. So this could include, if you're in America, for example, legal frameworks such as HIPAA, which stands for Health Insurance Portability and Accountability Act in the United States. In the UK, we've got the Care Quality Commission, for example, but also we've got the insurance, where we have to have our employer's liability, public indemnity, professional indemnity, for example. And there's also the GDPR, which stands for General Data Protection Regulations. So another thing for you to consider is the buyer will want evidence-based approach. So this is where the healthcare is increasingly driven by evidence-based practices. So research allows providers, yourselves, to incorporate relevant data, studies, and outcomes into their proposals. Now, I've mentioned where it's okay for you to use a case study that you've seen that someone else has used and has gathered the information, for example, and it is being used by the councils or in the community, for example. So it's okay to use that as well. So you also want to look at the credibility, your credibility of the proposal, and also that it instills confidence in the potential client or partner. So that's from the buyer's perspective. Another thing that you have to consider is financial considerations. Researching financial aspects such as what are the cost structures, reimbursement rates, budgetary constraints is crucial in healthcare contract negotiations. So providers must ensure that the proposal is financially viable for you, because it may be viable for a large organization, but it may not be viable for you as a micro organization. So you could possibly be a micro organization or a small to medium sized enterprise, for example, or a large organization or a charity organization. So it all depends on the organization and what the financial budget is that you have, for example, to be able to put forward for a contract. So look at the contract itself, and then look at tailoring the solutions, whereby every healthcare contract is unique with its own specific requirements. So one care contract could be, we require support workers, mental health support workers, for example. Another contract could be, we require healthcare assistants to do personal care. Another contract could be, we require nurses to do nursing care in a care home or in the hospital, for example. So look at the contract, see what is specific, what are the requirements, what are the objectives, what are the constraints. Research will enable you to provide a tailored solution so that you're able to put forward that proposal to address their distinct needs and challenges of each client, the buyer, for example, that you want to partner with. So think about this. I hope everyone's got a notepad and paper. Just drink my water. So think about you customizing and demonstrating your staff members and your organization. What is it that you can demonstrate to the buyer? Okay, the buyer, they have concerns, and it is increasing the likelihood of a successful contract outcome if you can meet that need. If you can have that advantage, if you do your research, you can be the 30% who wins that contract, because the 70% of people aren't doing it properly, for example. So do you want to be the 30%? Type in hashtag 30% winning the contract, for example. Okay, so you've got a good advantage if you do your research. So going on to another section here, which is key elements of a successful proposal, and I call this part 2. The essential components of winning a proposal. It outlines the following. You've got to have a clear problem. You've got to have a solution overview, detailed scope of work, timeline and milestones, budget and pricing details, and a compelling value proposition. And I'll break this down one by one. So a clear problem. So healthcare business need to have a clear problem statement that addresses the pressing issues or challenges that the buyer or the broader healthcare industry is facing, because you need to have that. So a problem solution, for example, a personal problem statement can be, in our healthcare organization, we have identified a significant increase in patient readmissions within 30 days of discharge, particularly amongst elderly patients with chronic conditions such as congestive heart failure, diabetes, etc. And despite the efforts to improve care coordination and discharge planning, these readmissions not only result in, it indicates potential gaps in our post-discharge care processes. It's addressing this issue is crucial to enhancing patient outcomes, reducing healthcare costs, and ensuring the sustainability of our organization. So that could be a hospital, for example, whereby they are trying to prevent readmissions because it is more costly to have someone in hospital day by day because of all the resources that's being used than having someone at home or in a care home, for example. So the problem statement, it clearly articulates the problem, doesn't it? Yeah, there's a specific issue, patient readmissions. It's identified the affected population, which is patients with chronic conditions, for example. It also highlights the impact on the organization, the hospital, for example, or the council. So the resource strain and potential gaps in the care processes. So the emphasis and the importance of addressing these issues for various reasons is that this clearly sets the stage for you developing a targeted solution and intervention to mitigate the problem and improve overall performance in the healthcare business, for example. So the second part, which I talked about, was solution overview. So staffing challenges faced by healthcare agencies. We propose to implement a comprehensive solution that optimizes our staffing processes. This will enhance our ability to meet the client's demands and promptly and efficiently. So it's important that you're able to explain this in a way that is according to the particular contract as well. So you will show evidence by you've got enhanced staff scheduling system. So for example, you've implemented a robust scheduling software or system that enables real-time tracking of staff availability, skills and preferences. So there you're talking about the solutions that you can provide them with. You'll be utilizing predictive analysis to forecast staffing needs based on historical data, seasonal trends and client demands. Now I'm going to go into that because this is really an important factor as well. For example, I've created this spreadsheet which is being done as a software, for example. And this is about predictive data in a certain location, whereby you know when staff are going to go off sick, the number of staff that's roughly going to go off sick because of the location, for one, and also the geographical area as well, and also this the history. There's data from years before, like the previous year and the year before and the year before, and you will see that there's a seasonal trend that's happening, and that is what's going to cause client demand for it to be high during those periods of time. You see it all the time. Christmas, people are going off sick because they're sick, for example, or a loved one or family member, for example, friend is sick, so they can't come into work. So that then impacts the company. Then you have to have agency come in, for example, to cover 4 shifts, for example. So I'm just explaining about the historical data in a certain geographical location. And this can be really anywhere around the world, but wherever it is that you are supplying and looking to supply staff, then you need to check out what the seasonal trends are, because you will see a pattern. Enable automatic notifications and alerts to quickly identify and fill open shifts, minimizing delays and maximizing staff utilization. So for example, you've got a staff member that's working, but you kind of got a feeling, or you know that possibly at this time of the year, or it could be a certain time of the day or month, for example, that staff member is going to go off sick, or they've got these appointments, for example. So then you've got cover to cover the workload, for example. So another explanation would be that you've got the staff members. You ask the staff members what is their availability, when are they available during the week, just in case if someone goes off sick, that you then got someone to cover, and then you can just quickly pull them in to go and cover that shift, and there's no impact there. So you want to also ensure that you have a good talent pool. It's so important that you do this, that you have a good talent pool here. and I'm hoping that I am in our group page. Excellent, yes, okay. So you want to make sure that you've got a good talent pool. You want to establish, and I just want to mention to my staff members, don't tag my friends. We only tag people that's in the group that have registered for the event, that's in this group and they're able to watch, not outside of this group. So talent pool, for example, you want to establish a centralized database of qualified healthcare professionals, including nurses, carers, and allied healthcare professionals, along with their credentials, certifications, and availability. You want to ensure that you regularly update and maintain your talent pool database to ensure that its accuracy and reliability of information is correct. So you want to implement and streamline recruitment and onboarding process to swiftly onboard new staff members and expand your talent pool as needed. You want to also make sure that you've got a client relationship manager. You want to foster relationships to gain insights into their staffing needs and preferences and expectations. Just bear with me a second. Let's answer a question here. Just answering a question here. Right, okay, so like I said, client relationship management. So you want to foster strong relationships with our clients to gain insights into their staffing needs, preferences, and expectations. You want to conduct regular checks and performances, because if you don't do this, you will not get it right, and you don't want to mess this up, because this is really important to make sure that you're getting good client relationships. And by conducting these regular check-ins and performances reviews to assess client satisfaction, and you'll be able to address any concerns or issues proactively as well. So you want to ensure that you are having relationships, keeping in contact with someone that you want to contract with. You want to also offer them flexible staffing solutions and customize staffing plans to accommodate varying clients' requirements, because it's so important to do that. And I'm just going to say a message. 1 second. So again, continuous improvement and training. So you want to provide ongoing training and professional development opportunities for staff to enhance their skills, their competencies, and also their job satisfaction. You want to encourage culture, continuous improvement and innovations within the organization, giving feedback both to staff and clients to identify areas for enhancement and optimization. It's important that you invest in technology and resources as well. I'm just going to drink my water. So that you're able to deliver high quality care and services to our clients. You want to ensure that you are providing seamless staffing operations to meet the needs of the buyer effectively and efficiently. So this is not only an approach that's comprehensive, but it is effective, and you will be looking at addressing the immediate staffing issues, but also it will be the foundation for a long-term success and growth in your business as well. So by meeting the buyer's needs to supply care staff and win the contract requires a thorough understanding of their requirements and the ability to present a compelling proposal that addresses the needs effectively. You also have to think about a detailed approach, which is a detailed scope of work. That has to be aligned as well, because it's important that you do that as well. So always think about your scope of work that you're going to be doing as well. So hashtag scope of work if that's something that you're going to be in charge of, for example. So moving swiftly on, I've talked about the problem statement. We're now going into the solutions overview, talked about staffing challenges that they face, and now we're going to talk about the next section here, which is the, just go on here, client relationship, which I mentioned, and I talked about the detailed scope of work, which defines the responsibilities and duties of care staff that you're going to supply. So what staff members are you going to supply? How many? What are their qualifications? What experience do they have? Who's going to be managing that team? What qualifications do they have to show evidence that they're able to manage a team effectively, to be able to deliver the service and be able to spot when things are going wrong so that they can act quickly. So who will be responsible for that? So you want to outline the scope of service that you're going to provide, such as the patient care, the medication, for example, the companionship, or any specialized care for a particular condition. You want to specify any additional requirements that are preferable to the buyer, such as it could be culture consideration, for example, language proficiency or specialized training needs that your staff members have undertaken as well. You want to clearly articulate the expectations regarding the staff availability, scheduling, flexibility, and communication protocols. Timeline and milestones. Develop a timeline outline. Make sure that you look at this and really go through the contract, the period, the staff recruitment, your onboarding, any, making sure that everything is clear, okay? That the timelines for submitting candidate profiles, conducting interview, finalizing staff assignments. You want to define that benchmark for performance evaluation, quality assurance with regular check-in and reviews to ensure alignment with the buyer's expectations. Because the buyer, when you're looking at applying for a contract, there may be a time where they say, right, I want to come and see you, or we're going to do a Zoom meeting and I want you to tell me how you're going to deliver. what you just said that you can deliver, for example. So be aware of what the buyer wants and make sure that what is in the contract that you've put in is what you've actually going to do and deliver. And make sure that you've got all the systems in place that's going to show that you have done that and evidence of that you've done it. There's no point just talking about it. What is the evidence that you've got? So you want to also look at the contingency plans for addressing any staff shortages or emergencies to minimize any disruptions to the service. So the next thing now I'm going to talk about is budget and pricing. So you want to always be transparent, for example, and you always want to look at what is the competitive pricing for the service that you want to deliver. So taking into account the staff salaries, the benefits, the overhead costs, the profit margins, you want to break down the structure, you want a pricing structure to illustrate the cost per hour or shift, for example. Could be what is the rate, like I mentioned to you about the hourly charge, then the percentage on top of what you would charge, the additional fees, charges for any specialized services, or if there's any overtime, what will the charge then, for example. Offer flexible pricing options such as volumes for long-term contracts or customized pricing based on specific client needs. You want to clearly outline any terms and conditions related to payment schedules, invoicing, procedures and penalties for late payments or cancellations. Compelling value proposition. You want to highlight the unique value that you provide your care staff and the services. You want to emphasize on the qualities that sets you apart from the competitors. Showcase the qualifications, experience, credentials of your staff members, including any specialized training or certification that they may have. It's so important that you look at emphasizing the commitment to quality care, patient safety, and customer service. What case studies do you have or performance metrics that you can demonstrate the ability to adapt to any change in needs, delivery personalized solutions that exceed the buyer's expectations. You want to articulate the benefits of partnering with your agency, such as reliability, flexibility, responsiveness, peace of mind, of knowing that the staffing needs are capable of meeting the needs and they're in safe hands, basically. Is everyone writing this down? I know it's a lot. So, when a care agency applies for a contract, you must ensure its pricing strategies are both satisfactory and it meets the buyer's needs and it maintains profitability for you. It's so important that you do this because it's not about being the cheapest, it's about, can you actually do this? Can you deliver it? But can you do it at a price that is going to be beneficial to your staff and to you? Because if you're going to go in at a low price, that means that the staff members are getting a lower rate as well. So be mindful of that. The larger organizations, they can do that, but the smaller you are, you can't really, try and compete with a larger organization. So it's crucial that you strike the right balance between offering competitive prices that attracts clients and ensuring that you have got profitability to sustain your business. While undercutting competitors, you may win short term, but long term, the financial strain will be too much. You're going to compromise on service and quality in the long run. So pricing should not be at a level that reflects the value of the services provided, while also you're generating sufficient revenue to cover cost and also have a reasonable profit margin. There's nothing wrong with that. So various pricing models. So cost plus pricing. This model, it involves calculating the cost of providing care services and adding a markup to cover overheads, expenses and profits, for example. It ensures that all costs are covered and provides transparency to the clients. So for example, you've got to break down the hourly rate for each item. For a staff member, for example, what your rates are, how much does it cost you to, what are your expenses, what are your office expenses, telephone, mobile, taxes, etc. All these have to be put into your cost. So now we're going to go into based pricing. This model focuses on perceived value of care services to the client rather than the cost of production. Agencies, you can set the prices based on unique benefits and outcomes that deliver aligning pricing with the value received by the client. So competitive pricing, this involves service based on market rates and competitive pricing. And again, it's okay to be competitive, but it's essential again to justify why you're charging the prices that you're charging. And if you're charging a premium price, then you have to discuss why that is, that you've got highly qualified staff. Your percentage of staff are, say, 80% are over level 3 in care, for example. I'm just using that as an example. So you need to think about what the factors are. What is the market demand? Agencies, you should assess the demand for care services in your targeted area and adjust your price accordingly. High demand may allow for higher price. Remember I said about the 2%? Look at offering a higher price, because there's going to be the saturated markets where there's a competitive price and the cost and the margin is so small that you may not see much of a benefit for you having all the stress of running a healthcare business, for example. So cost structure is important. Understanding the cost structure and providing the care service. It's essential for you to set the prices. So costs may involve staff salaries, administrative expenses, overheads, and any additional investments that are required to maintain the service quality. So perceived pricing, this should reflect the perceived value of the care services to the client. Agencies can enhance perceived value through quality improvement initiatives, specialized service, and exceptional customer experience, for example. So as a care agency, to be successful, you want to apply for a contract. It must develop pricing strategies and strike a balance between competitiveness and profitability. It's got to be equal. This involves exploring various pricing models depending on the organization that you are working with, for example, because you don't want to be going too low and then find out 6 months down the line, I'm struggling here. Yeah? So just think you're a small business. Don't try and compete with the bigger companies. You're not ready for that yet. So look at analyzing your markets, conducting thorough research, and prevailing market rates for care services in your target area. And this may include analyzing pricing data from competitors and benchmarking, understanding the pricing strategies of your competitors, including any discounts, promotions, or packages, deals that they offer. Find out what that is. Go and look and see what your competitors are doing. because you're missing out if you haven't done that. Use this information to position your bids competitively in the market while you're offering a value-added service that's different from your competitors. You want to understand what your cost structure is. By evaluating the agency cost structure, you'll determine the expenses associated with providing care services. And this could include direct salaries, for example, training, supplies, as well as indirect costs such as administrative overheads. You want to calculate the break-even point and the desired profit margin for each bid to ensure that pricing covers all costs while generating a reasonable profit. Because sometimes people will knock you down, but if you start off high, then you're still going to be meeting higher than what you expected. You're not just doing it to break even, just to prove a point, for example. So identify areas where costs can be optimized without compromising the service quality to improve competitiveness. So this could include specialized care programs. I talked about this, where you could provide additional training for staff. There's also technology. You can also look at telehealth, which is, it's out now, so maybe some of you are qualified to do that. What personalized care plans can you do that's really tailored to individual client needs? Highlight these values added services in your bids to demonstrate the unique benefits of clients that will receive by them using and choosing your agencies over your competitors. Offer flexible pricing options. Recognize the difference. Clients have varying budget constraints, preferences, so offering a flexible pricing option can increase competitiveness. This can involve tied pricing structures of care needed, allowing clients to choose this option that best fits their needs and their budgets. So consider discounts for long-term contracts or bundled services incentives. Negotiate tactics. Look at this as an essential skill for your care agency to secure favorable contracts. You want to build strong partnerships and achieve mutual benefit outcomes. So let's dive into this a bit further. So the importance of effective negotiation. Effective negotiation is crucial for care agents to secure contracts and to ensure that it's in line with the objectives while also meeting the needs of your partners that you want to work with. Negotiation will allow your agency to discuss the interests, you'll be able to address any concerns, reach an agreement that maximizes value for all parties involved. The successful negotiation can lead to a long-term partnership, increase client satisfaction, and enhance profitability for your agency. So strategies that you need to think about for building rapport, you want to look at the other parties, essential for establishing trust and creating a positive negotiation environment. You want to invest time to know the other party's priorities. What are their goals? What are their constraints? This involves active listening, asking probing questions possibly, and demonstrating empathy. You want to understand the needs and the motivations that drive other parties' negotiation stance, and this insight allows the agency to tailor its uniqueness, and your proposal will be addressed in those needs, and you'll do this effectively. So creating a winning outcome is, for example, You want to be able to aim for a win-win outcome that satisfies the interest of both parties, foster a collaborative relationship, look for creative solutions that expand the, you want to look at it's like a pie, right? So everyone gets a piece of the pie that applies for a particular contract. So this may involve exploring trade-off package deals or alternative terms that meet the underlying interest of each party. You want to focus on building long relationships, long-term relationships rather than short-term gains. Sustainable partnerships build mutual trust and respect, and this is more likely to yield positive outcomes in the long run. So let's look at some common negotiation challenges here. To overcome challenges, you want to focus on finding common ground and areas of agreement before addressing areas of disagreement. Using an objective criteria such as industry benchmarks or standards support your negotiation position and rational proposals, for example. So be prepared to compromise on a less critical issue while standing firm on essential aspects that are non-negotiable. You want to ensure that you're doing effective negotiation strategies, and it's vital that for you as a care agency that you secure favorable contracts and build successful partnerships. You want to ensure that you're doing active listening, and this is important that you do this because it will help you to fully engage with the other party's communication with you listening correctly, focusing on understanding their perspective, concerns, and underlying interests. You want to demonstrate attentiveness through non-verbal cues such as eye contact, nodding, and paraphrasing to ensure accurate, comprehensive. You want to avoid interruption or formulating responses prematurely, allowing the other party to express their thoughts and feelings fully. So by actively listening to the care agency and listening to the organization, the buyer, for example, you can gain valuable insight into the other party's needs and priorities. So you want to ensure that you're facilitating more effective negotiations by asking probing questions. So I want you to look at what you can offer. You want to look at, there's different types of investments. You're going to invest time, you're going to invest your effort, you're going to cultivate trust, you're going to have mutual respect, you're going to build rapport with the other party, which will foster a positive negotiation environment. So let's look at using objective criteria for decision making. Objective criteria provides rational basis for decision making in negotiation, reducing reliance on subjective judgment or emotions. So identify relevant criteria such as industry standards, market benchmark, any legal requirements or scientific evidence to support your negotiation positions. You want to use objective criteria to evaluate your proposals, assess any trade-offs, and justify negotiation to the other party. And it's important that you look at this because when you're looking at negotiating, you want to have an objective criteria so that you can increase your transparency, your credibility, and likelihood of reaching a mutual acceptable agreement. So, you want to be crafting through a tailored proposal by balancing competitiveness, profitability, and pricing. So, you want to employ effective negotiation tactics for successful outcomes. So now let's look at the next part, which is the ending part towards the end. It is contracts. Okay, so I'm going to click here. I'm going to see whether I can also share my screen, because I tried to do this yesterday. Okay, let's see if I can share. Scroll down. Might have to go to open new tab. Let's have a look here. I'm just trying to see here. I'm trying to take you onto Contract Finder. And I think I've pressed something that I shouldn't have pressed. I'm going to carry on. Am I still here? Yes. Right, so I'm just trying to get onto share my computer screen. Put the link in the chat. Excuse me. So, in the chat, I'm just posting now how to find contracts. And I'm just going to see if I can share my screen. Okay, so I'm going to go onto the government site here, which the link that I put in here is to do with Contract Finder, which is the UK, for example, and you'll see it takes you to the front of the page whereby it says Contract Finder, and it says Contract Finder lets you search for information about contracts worth over, say, 12,000, for example. There's lower value contracts and there's also higher value contracts. So at the moment I'm on the lower value contract, and it's got here, before you start, there's public contracts Scotland for opportunities, there's also sell to Wales for opportunities, and there's also e-sourcing Northern Ireland and e-tenders Northern Ireland. depending where you are. We will do the link for America as well. And I'm just going to start now. And I'm going to, when I press that button start now, it says find a contract. So from that point, you then looking at the contract, but first you've got to put the keywords in, and the keywords could be healthcare, nursing, whatever it is that you are currently doing as an agency. So you just type in healthcare, for example, just doing a quick one here, and then click search. And you'll see there's a lot of contracts that come up here. And I'm just trying to see how I can swap this around. Let's enhance. Picture. Usually there's something that says, allows me to share my screen, but I'm not sure. Share to page groups. Post. Okay. Post details. Nope, I'm not going to remove the module. Features link. Right, so this because I was just trying to see if I could change my face so that it's got my face in the corner, and then there's the screen where you can see my screen that I'm showing you at the moment. So I'm on Contract Finder, and for example here I'm just going to show you one for quickness. Cash and benefit. For example, there's one which is closing October 2024. It's currently open at the moment. So that's no good. We want to look for continuing health. There's one here for, say, for example, children and young people continuing health, NHS, for example. And this contract is closing on the 31st of October 2026. So there's hundreds of contracts here. You can even supply bedding, towels, everything. I mean, healthcare is such a broad term, but you could put in, for example, supported living. You could put in mental health as a keyword, for example. And I'm just putting that in now, mental health as my keyword at the top of the page. And I scroll down, you will see that on the page, you will see, when you are on there, you'll see early engagement, future opportunities, awarded contracts. If you click on awarded contracts, you'll be able to see those that have been awarded a contract, and then you approach them to help them with that contract, look at working in partnership with them, for example. And I'm going to do update, and it will change it slightly. So now I've got a different one because I've put mental health in, for example. So it's got mental health recovery, for example. It's got advocacy, telephone and messaging based advice service, mental health early access in the community, child, adolescents, mental health services, CAMS, tender for healthcare, specialist mental health services for inpatients. So there's young adult services supporting those aged 17 to 24. Continuing healthcare. When it says VCSE, that is not for you. That is for a large organization, usually like a charity or a very large organization. So on here, there's about 17 pages. So when we finished, here you'll be able to go through here and see what I'm seeing. For some reason I'm not able to turn it round so that you've got me and the screen that I'm showing you, so apologies for that. And then the next one, the next link here is, and this link that I put in here is for the UK, so I just put in here what that was for, so that you've got this information. And the next one, for example, is Health Trust Europe. So that's another contract portal in the UK. And if you're doing recruitment, then you type in recruitment. Keyword is recruitment, healthcare, for example, or recruitment agency, for example, or permanent or temporary agency. So remember all of these types of keywords, you have to keep changing them around. So that I've just put in is the Health Trust Europe, and it provides procurement services and solutions, for example. So you can also look at this as well, see what contracts are available for the UK, that is. And then there's this one, which is SamGov, and I'm going to put the link here. See, all of those links that I've put in, you'll need to register with them as an organization when you are set up and ready. There's no point doing things before you're ready, for example. And I'll just explain what SamGov is. It stands for Systems for Award Management, and it is a federal platform in the USA, and it's very good. It's got lots of contracts on there, and I will be doing some contract training on the American one because I think it's important, because we do have clients here that are in America as well as around other parts of the world. I will be covering global aspects of things. So with regards to SamGov, I'll just explain that to you. SamGov, it serves as a central registration platform for entities seeking to do business with the US government, including contractors, suppliers, grant recipients. Businesses must register on SamGov in order to be eligible for federal contract grants and assisted programs. So it just tells you as well that it consolidates federal procurement award systems into one integrated database, streamlining the registration process and improving data accuracy and integrity. So for business opportunities, like I said, this is SamGov. It will show you future, past contracts as well. And this is for America. So I've just put the link there for you as well. And this is where you would look at what opportunities there are, just with the same as the UK. There's a certificate and verification that you have to go through with sam.gov, for example, and they'll also ask you specific questions, and they will find contracts that are relevant to you, for example. So, do check that out, because it is a good thing to look at all aspects. Even though you may be in the UK, have a look at the American one as well, because you may want to contract there one day. Same with America, look at the ones in the UK. You may want to contract there one day. We are, we're global, so why should we not work globally if we can and if we want to? Right, so I hope that you've enjoyed the training today. It's been wonderful. I've really enjoyed training you. If you are interested in hearing more, if you'd like to hear more, then do book a free 15-minute with us, and I will gladly speak with you, especially for those of you that want to perhaps be global, that you want to have a global organization. Then, speak with me, and I'll be able to talk to you about that as well. And another thing, we got our contracts bootcamp, which is next week. I'm really excited, and I'm just going to put the link in for that. It's only $444, for example. So you don't want to miss out, because it will be going up when it's the first of the month. It's going to double that, because what we offer is so huge as well. It's 3 days where you'll be doing contracts for 3 days. We'll go real deep and really dive into that as well. So that's our contracts bootcamp. It's the second one this year, like I said, but the price will go up. So do grab your grab the link and register. We do start next week, but we do hold them every month. So if you can't come next week, don't worry. You can come to the other ones that we have throughout the year. So do book a free 15-minute appointment with us as well. If you're coming to the boot camp, you want to get in as quickly as possible before we get sold out, for example. And I also would like to ask you all to subscribe to my YouTube channel, where I do training there as well. We've got memberships, we've got lots of things going on as well. And I just want to really say thank you to all of you for being here today, to spend your Friday with me for over 1 hour. I am so honored and blessed to have you with me. I hope that today that I've served you all well and that you've learnt from it. I have put the links in the chat there for you to have a look at your own types of contracts. Look at and see which ones you want to go for. Which ones do you want to go for? Are you going to do, because those links that I've put in is for recruitment as well as home care, supported living, for example, lots of different healthcare things related. It's not just about support workers and nurses. There's cooks, there's chefs, there's cleaners, there's, you can be doing laundry. There's lots of things that's going to be beneficial for you by applying for these various contracts. So I hope that you've enjoyed today, and thank you so much for being here, everyone. I look forward to our training that we've got next week. We've got our 3-day boot camp, which we start at 9, we finish at 5, for example. I will be doing a live here next week regarding, I'm not sure which one it is, whether it's the recruitment or CQC. I will have a look, but I will put the two events up anyway so that you can all see them. And I just want you to really think about it. Write down 3 things that you want to do this weekend. Are you going to apply and look for contracts for your organization, for example? Are you going to join us at the boot camp, for example? We'd love to have you. I can see there's some of you that's been here on our boot camps as well, so I appreciate you. Thank you for coming back here, listening to me talk. I hope everyone's had a wonderful day, and do subscribe to our YouTube channel. We have got lots of information to give to you, and we've got some amazing things coming up in April. We've got the podcast starting the 1st of April as well. I'd love for you to be able to be in there and join us. So thank you so much, everyone. Have a wonderful weekend. Take care. Thank you. Goodbye.